Today we have Katharine Donnelly, a behavior therapist at the Biobehavioral Institute in Great Neck, New York. Katharine is also co-author of the upcoming book, Overcoming Depersonalization Disorder, a Mindfulness and Acceptance Guide to Conquering Numbness and Feelings of Unreality. Katharine, what is depersonalization?
Depersonalization is a psychological numbing reaction that causes the person who's experiencing it to feel detached from their emotions or their experiences. It causes almost a dreamlike sense of reality, which can become very unpleasant if it's experienced in a chronic state, such as what we see in depersonalization disorder. Depersonalization disorder causes impairment in a person's life and their functioning, causes a significant amount of distress, obsession about when the condition or the experience will remit, and it's something that causes extreme impairment in the person's life who experiences it.
Who gets depersonalization?
Depersonalization is often associated with the experience of some kind of trauma or having gone through some period of extreme stress. This can be something relatively short-term and acute, such as rape, or it can be something more long-term, like chronic stress at work over many, many, many years. We also see that some people who have hypersensitivity to certain drugs can become susceptible to experiencing chronic depersonalization after an episode of drug use, particularly marijuana or a hallucinogen or ketamine. And in these people, unfortunately, the effects of the drugs never completely wear off and causes a chronic depersonalization state. That said, not everybody who has depersonalization disorder can trace it back to any specific event that brought it on, but you know, in more cases than not, there's some sort of chronic or acute trauma or stress or drug use that was experienced by the person.
Does depersonalization often co-occur with other psychological illnesses?
Yes, and it stands to reason, too, because when you think about extreme or chronic distress, you would see that in somebody who experiences another psychological disorder, like chronic or very severe depression, borderline personality disorder, post-traumatic stress disorder. Depersonalization is often seen in people who also meet criteria or endorse symptoms of post-traumatic stress disorder. We might see a depersonalization reaction in panic disorder, obsessive-compulsive spectrum disorders as well. So there's a lot of co-occurrence between depersonalization and chronic forms of other conditions as well.
Is there a treatment for depersonalization disorder?
Well, unfortunately, there's no cure for depersonalization disorder. There have been some trials of medications that have been used to treat certain symptoms of depersonalization or other psychological phenomena that are unpleasant that are experienced in addition to depersonalization, such as depression or anxiety. Selective serotonin reuptake inhibitors or tricyclic antidepressants have been used and found some efficacy in treating some of the symptoms of depersonalization. Naltrexone, which is an opioid antagonist, that's been used and has been shown to be effective in some people. Anxiolytics, including benzodiazepines, have been used to treat anxiety that's often associated with depersonalization disorder, but no one medication is effective for everybody. Psychological treatments have also been shown to be effective in some people, whether we're talking about cognitive behavioral therapy or exposure and response prevention. Some of the behavioral techniques allow people to re-enter life and experience some of the residual discomfort or anxiety that comes along with having depersonalization disorder. And this upcoming book, Overcoming Feelings of Numbness and Unreality, is going to be looking at acceptance and mindfulness strategies in terms of dealing with symptoms of depersonalization. Basically, mindfulness and acceptance promotes an attitude of willingness to experience the symptoms while becoming engaged in things that are valued in life, despite existing feelings of depersonalization.
Great, thank you so much for being with us today.
Sure.